sleeplessness. Sleep problems don't just affect a child's ability to sleep. Chronic exhaustion can lead to daytime behavioral problems, learning disabilities, and a decrease in the brain's overall ability to function. The suffering doesn't affect the child, however. Chronic sleep deprivation pushes families into crisis. Emmy loves to hear the story about her first night at home. Although otherwise healthy, she'd spent the first week in the NICU for underdeveloped lungs. The night before we brought her home, the nurse in the NICU looked at us and smiled and said, "You better go to a movie, have dinner, it's the last movie you're going to see." If I'd known that, there was no way I would have let Rob chose a movie. Nothing could prepare me for baby's first night at home. And after a sleepless night, I tearfully handed Emmy off to my mom. "Mom, you've got to take her. I didn't sleep at all." Little did I know that that would be the first of 2007 sleepless nights and nightmare days. Over the next 5 years, we saw a pediatrician, a play therapy team, a respirologist, 2 infant psychiatrists, 2 OTs, an ENT to have her adenoids removed, an allergist, and her own caring GP. We watched helplessly as our vivacious, fun-loving daughter collapsed into an angry, anxious shell. With no obvious pathology, her deterioration was attributed to developmental coordination delay, sensory processing regulatory disorder, ADHD, and most painfully, an attachment disorder. I was responsible for my beautiful daughter's suffering. We were terrified for Emmy's future and our own. The exhaustion and emotional stress had taken its toll on our relationship. But where was I to turn? We'd exhausted all options. We knew we were lost, but each place we stopped to ask for directions just shrugged and pointed us somewhere else. Despite the continuing focus on Emmy's daytime behavior, we kept insisting that we had to address the sleep problem. Finally, after over 100 appointments and 4 years after we first sought help, Emmy was assessed at Sunny Hill Sleep Clinic and diagnosed with Willis-Ekbom disorder and periodic limb movement. Our long journey had ironically taken us to 2 of the most common neurological disorders. Our daughter missed 2007 nights of sleep. Her body suffered, her brain suffered, our family suffered. Much of it could have been avoided with better knowledge and screening. This event's an exciting way to celebrate the anniversary of the Children's Sleep Network. It was born a year ago as a result of an exploratory workshop held at the Peter Wall Institute for Advanced Studies and hosted by Dr. Ipsiroglu and Dr. Carlton. The event brought together international researchers with a goal of establishing a framework for recognizing sleep problems and identifying research needs. The collaborators believe that conventional models that focus on a child's disruptive sleep-wake behaviors are inadequate, and worse, serve to disempower families from advocating on their child's behalf. As a group, they agreed that sleep should be approached from a holistic or person-centered medical perspective. Such a cutting-edge perspective required an equally innovative solution. The group agreed to adopt a collaborative research model that would bring together researchers, parents, and community partners. The Children's Sleep Network invited me to spearhead the parent advocacy group. As collaborative partners and advocates, the Children's Sleep Network's mission is to reduce needless suffering and improve health outcomes for all children, but those with neurodevelopmental disabilities in particular. I realize I missed one of my slides. 2 of my slides passed. My daughter drew this picture when we started treatment. These were her goals. It was holding a pencil. She was in kindergarten. And worrying, she said she worried a lot because her body was fidgety, and she wanted to go to sleep and stay asleep. So just a quick overview of how this, keep dropping things over, of the next 2 days. Today we're going to examine the consequences of sleep problems in children with neurodevelopmental conditions and how to improve their outcomes. It will feature a keynote lecture by Dr. Kirsten Graham, and then we'll have a brief discussion about pharmacogenomics and behavioral adverse drug reactions, and then we'll move into a panel discussion between some parent advocate groups and other community partners. Tomorrow we're going to break into smaller groups with a more focused approach and looking at how we can structure the public discussion moving forward.
It's a privilege to be here and present two established but still quite new clinical concepts. Chronic sleep deprivation and the effects of chronic sleep deprivation on so-called disruptive daytime behaviors. And behavioral adverse drug reactions impacting daytime behaviors. And how we deal with chronic discomfort up to pain in our clinical practice. These are obviously gaps in our understanding, and in order to overcome current gaps, we are suggesting a novel participatory research concept, which over time will change some of our traditional top-down approaches in pediatric sleep medicine. I'm Osman Ipsiroglu. I'm a pediatrician with special interest in sleep medicine. And I would like to tell you briefly about my personal story. I moved a few years ago to British Columbia, and I learned over the last few years two key messages. Problems are not called problems in British Columbia, they are called challenges. Second take-home message, the second lesson I got is we focus systematically on challenges over the day, so-called disruptive, challenging daytime behaviors, but not on challenges over the night, sleep problems. This is actually not much different from my very personal and own learning experience. In my first life, I did my training in Graz, in a small idyllic Austrian town. When I heard for the first time the term sleep medicine, I laughed out loudly, because obviously it sounded funny to me. Then, 10 years later, at the University Hospital in Vienna, I was the director of the first pediatric sleep lab, which became also accredited as the first pediatric sleep lab in Austria. At that time, it was a nightmare for my team and me to assess kids with neurodevelopmental disabilities and disorders. Later on, as the director of a child developmental center, now I was working mainly with kids who have neurodevelopmental disorders and disabilities. I realized how little our knowledge about sleep disorders of kids with disabilities is, and how far away this knowledge was from day-to-day time reality. Now, in wonderful Vancouver, working in developmental pediatrics, I had to take qualitative research courses. And thanks for applauding me for that. In order to understand the reasons for certain knowledge gaps in the medical system. The summary is we need functional assessment concepts in order to overcome categorical diagnoses, which basically lead to systemic gaps in our understandings. Sleep problems can be treated. These are the overviews of two video sleep studies of a girl who had been suffering for 9 years under chronic sleep deprivation. You see above, where's the cursor? Here. You see above, before therapy, 13 awakenings per night, and signs of restless, non-restorative sleep indicated by frequent position changes. Below, no awakenings. After treatment, just a few position changes again, which would be considered to be normal. Over the last 1.5 years, this girl, who had been labeled as a patient with intellectual disability, with several mental health disorders, has become emotionally more stable. Her cognitive skills began to improve. Her anxiety has decreased as her hallucinations during the falling asleep situation have disappeared. This patient began to develop coping strategies. This is an original quotation from her aides. Resilience increased, her teachers. She is less irritable and she allows you to touch her, the foster parents. She caught up in school. Her math skills improved last year from grade 3 level to grade 7. The question is how to make this anecdotal success story reproducible. How to create evidence. And how to prove that chronic sleep deprivation was really the cause. So our research questions are to unravel the currently unknown dimension of chronic sleep deprivation, understand the dimension of the problem, develop a participatory research concept for home-based functional assessments, create evidence through better evaluation of current treatment concepts, and at the end stop needless suffering leading to emergency situations and crises. We did lots of homework over the last years. Dr. Hall, who is in the audience and will lead tomorrow at working group, developed a knowledge dissemination concept supported by CIHR. Les Matthews from Thompson Rivers University established the Sleep Science Conference where knowledge exchange is happening yearly at a high level among healthcare professionals, various healthcare professionals. Our team, supported by various partners, developed the concept of clinical comprehensive sleep assessments, which can be done in the community. We developed the home-based sleep video technology and we developed an app for assessing disruptive sleep-wake behaviors and collecting information in structured way. These functional assessments over the last years, my main clinical research and clinical work, enabled us to assess and describe the presence of, like in Kirsten's story, well-known adult sleep disorders in infants, toddlers, and non-verbal children. Unravel some disruptive sleep-wake behaviors due to discomfort or pain in non-verbal patients. Unravel so-called behavioral adverse drug reactions. This is a new concept. And qualitative methodologies help us to identify emergency situations, crises from a parental, caregiver, medical and health economic perspective. The concept of behavioral adverse drug reactions is quite new, and I would like to show you briefly Dr. Bruce Carlton's
One of the key outcomes when you use mental health medication or medication for sleep is to continue to look at issues relating to harm. And it's not so obvious. Sometimes drugs cause behavioral adverse drug reactions, things that change a child's behavior for the worse. So we might see aggression, we might see sleeplessness, we might see irritability, frustration, confusion. Those are the kinds of things that you need to watch for as a parent.
So Dr. Carlton is leading the active pharmacovigilance program in Canada, and we will have later on a longer 4-minute long message explaining a little bit also the background. The objectives of this network meeting are to start a public discussion about how to overcome current gaps in our clinical system, which result in chronic sleep deprivation, emergency situations. We will explain what emergency situations are for us and for parents, and inappropriate medications. We will come up with a perspective that respects, we hope to come up with a perspective that respects the needs of patients and families. And we hope that our concept will not increase costs of the healthcare system, because it is more functional and brings stakeholders together. We will first hear the keynote lecture by Karen Spalt, who is a neuropsychologist. She's an associate professor in Belgium and affiliated with several university institutions in Brussels, Shanghai, and now very recently in Maastricht. Congratulations to that, Karen. Studying night-day developmental profile of children belongs to her expertise and is more than her expertise, also her passion. Karen published 2 books, many articles, and she advocates that sleep-wake states should be seen together and not separately. I met Karen 2 years ago at a meeting my mentors had organized, and when we came up with some new concepts that, for example, Willis-Eckbaum disease can also happen in early childhood, there was a need for a kind of review, and we invited several internationally renowned researchers to show the data and discuss with them, get a feedback. Karen was among the invited researchers, and since that time we started collaboration. This year she has been awarded with the Peter Wall Institute for Advanced Studies International Scholarship. She joined our qualitative research seminars at the beginning of summer. She is here for giving this public lecture and catching up with the research we are doing, and will come again next year and is involved in several research projects. Karen, thank you for coming.